Metformin is a widely prescribed medication. It's commonly used to treat type 2 diabetes. Millions of people rely on it to manage their blood sugar levels. Metformin has been around for decades. It's known for its effectiveness and safety profile. Doctors often choose metformin as a first-line treatment for type 2 diabetes. This is because it effectively lowers blood sugar. Metformin also has a low risk of hypoglycemia, which is dangerously low blood sugar. Metformin is not a quick fix, it's a long-term medication. It works gradually over time. Many people wonder, what happens in the first week of taking metformin? In this essay, we'll explore the short-term effects of metformin. We'll discuss how it works and what you might experience in the initial week. Metformin helps lower blood sugar in several ways. Firstly, it reduces glucose production in the liver. The liver is responsible for making glucose. Metformin helps keep this process in check. Secondly, metformin improves insulin sensitivity. Insulin is a hormone that helps your body use glucose for energy. With improved sensitivity, your cells use insulin more effectively. Thirdly, metformin slows down the absorption of glucose from your gut. This means sugar enters your bloodstream more slowly after meals. All these actions combined lead to better blood sugar control. It's important to remember that metformin doesn't cure diabetes. It helps manage the condition and prevent complications. In the first week of taking metformin, you might not notice significant changes in your blood sugar levels. It takes time for the medication to build up in your system. Most people start to see some effects within the first 2 weeks. However, some individuals may experience improvements in their blood sugar control within the first week itself. This varies from person to person. It also depends on factors like dosage and individual response to the medication. It's crucial to continue taking metformin as prescribed by your doctor, even if you don't see immediate results. Consistency is key when it comes to managing diabetes effectively. Side effects. Navigating the initial week. Metformin is generally safe. However, some people experience side effects, especially in the first week. The most common side effects are gastrointestinal. These include nausea, diarrhea, stomach cramps, and loss of appetite. These side effects are usually mild and temporary. They tend to subside within a week or two as your body adjusts to the medication. Starting with a low dose and gradually increasing it can help minimize these side effects. If you experience severe or persistent side effects, it's essential to contact your healthcare provider. They may adjust your dosage or consider alternative medications. Benefits and recommendations. Who should consider metformin? Metformin is primarily prescribed for individuals with type 2 diabetes. It helps them manage their blood sugar levels and reduce the risk of long-term complications. In some cases, metformin may also be used to treat prediabetes. This is a condition where blood sugar levels are higher than normal but not high enough for a diabetes diagnosis. If you're considering taking metformin, it's crucial to consult with your doctor. They will assess your medical history, current medications, and overall health to determine if metformin is appropriate for you. It's important to follow your doctor's instructions regarding dosage and timing of medication. Lifestyle modifications such as a healthy diet and regular exercise are also essential for managing diabetes effectively. Conclusion: metformin and you. Metformin is a valuable medication for managing type 2 diabetes. While it might not produce dramatic changes in the first week, it gradually helps regulate blood sugar levels and reduce long-term complications. If you're starting metformin, be patient and consistent with your medication. Manage potential side effects by starting with a low dose and gradually increasing it. Remember, managing diabetes is a journey. Metformin can be a helpful tool along the way. Always consult with your doctor to determine the best course of treatment for your individual needs. Thank you for watching. If you found this video helpful, please like, share, and subscribe to our channel for more health tips and information.